Hello, I'm Dr. Harpal Bains, and I'd like to talk a little bit about testosterone and how what we do are different from a conventional practice. Now, most people would be starting to feel the signs of testosterone depletion, and they start Googling, and that's when they figure out that, you know what, it could possibly be testosterone. They're usually not very sure at this point, and most of them will end up getting a blood test. The typical blood test that you do get when you ask your GPs for it is the total testosterone, amongst a whole host of other things. Total testosterone is basically all the testosterone that's available in your body. The problem with getting total testosterone is that it doesn't really give you a clear picture of what is actually reaching your cell. So when we do a blood test, not only do we look for the total testosterone, we look for the free testosterone as well. And the difference between this and the other one is that total refers to all of it. Now, a lot of this is actually bound. It's bound to this thing called your SHBG, sex hormone binding globulin. And the ones that are bound are not available for your body to use. And the ones that are available for your body to use are the free testosterone, of which part of them are bioavailable for your cells. With SHBG, if you have a really high SHBG, it means you could have a testosterone level that looks absolutely brilliant, really high, but you could have a tiny amount that's actually reaching your cells. In this instance, a person would have all the symptoms of having low T, but when you look at their results, they look great. There's nothing wrong there. Another thing that we also look at, and it's quite important to look at this in conjunction with everything else, are the estrogen levels. Now, estrogen is quite misunderstood in the male. A lot of people, especially when you read on all these forums, think that, you know, estrogen that's too high is very bad. It's not quite as simple as that as with most of these things. It's quite a bit more complicated. One thing it does give us information about is how much testosterone is actually available in your body, because testosterone is converted, some of it is used as free testosterone, quite a bit of it is converted to estrogen as well. So just by looking at the levels of estrogen, it then gives me even more information as to what's happening to you, what's going on. At the same time, we do look at your thyroid, because thyroid is very strongly linked with testosterone. And when you look at all these different parameters, look at what your brain's telling your testes to do, that's another way as well of telling where this person is. It's not a simple case of just looking at your total testosterone. A lot of other things come into play, including your history, which needs to tie in. And I think that's what makes us different. Thank you.